I'm a diabetic. I have congestive heart failure. And I have now kidney failure. I don't get up and down the stairs very well. As far as laundry, I don't get that done very well. As far as meals, I don't get that done very well. Some things seems easier to do than others. Same as like it's easy to come out here than to go in the kitchen and fix a meal.
I come out about once a month, and generally we have a chance to catch up on what's been going on. Just reviewing some of his advanced care planning, looking at personalized aspects to how he prefers to receive and view treatment. We had the pharmacist come out once to talk about medications that he's taken and just understanding of what they're doing and having conversation around what Mr. Dixon sees as important and working well.
One of you might be able to smell this. It's a beautiful smell.
Oh yeah.
Growing a vegetable to eat or a flower plant to look at gives me that joy. It's just a passion in me that I love gardening. I love farming.
As treatment of chronic disease becomes more involved and lifespans increase, patients and their families can feel overwhelmed. From multiple specialist visits and numerous medications to financial, spiritual, and emotional stress, persons with serious illness and their families can fall through the cracks.
LifeCourse is an innovative approach to supporting patients and families who are in their last few years of life. So folks who may have advanced heart failure, they may have advanced cancer, advanced dementia, COPD, Parkinson's, any of a number of conditions. Healthcare does a really nice job of taking care of folks when they're in the hospital. And then we do really good when folks get very near the end of life. What we don't do is well in between. What can be months, what can be years of time that a patient and family will face, struggle with, be overwhelmed by advanced serious illness, and to, on some level, abandon folks during that long period, I think it's something that we can no longer do.
How are things been going?
Well, pretty well.
Pretty well?
Pretty well.
We use in the LifeCourse model a lay healthcare worker who has likely life experience supporting someone with really advanced serious illness, but isn't a trained clinician. We call them care guides, and their job really is to partner with them in navigating the system, in navigating the other systems that they may need to intersect with, so not just healthcare, but social service systems and some of the other social assets.
They joined almost 2 years ago. And then we started meeting, and as I look back, it was monthly. We talk about both medical and non-medical concerns in my visits.
She's kept in close touch with us and referred us to people that we needed to be referred to. She's been a real resource person for us.
She listens to me. I talk and she listens.
When patients talk about what matters most to them, what ends up showing up less than the majority of the time are their physical health needs. So beginning to understand that 70% of the time, it's about all of the other aspects of self. And so this has given us a way to ask about that, to be able to capture it in the record, and then to be able to, with patients and families, develop that plan.
What you've helped me do is write a story that's now in your medical chart that includes those details that haven't been there in the past.
What we really are trying to do with Care Guide partnering with an individual and their friends and family members is to engage in an empowerment model, to be clear about what matters most, and then to really enable them to engage their primary care team members, their specialty care team members, but more importantly, all of those supports that exist outside of a healthcare system that they're going to need in those, last several years.
I came to grips with my mortality a year ago, February.
There's a continuity in relationship that seems to be really important to our patients. I'm still there even when they've transitioned into another level of care.
By coming to grips with death, I found peace. And that's available to anyone.
I think he's taught me a lot about how to approach a serious illness with hope.
The last project Bob completed is a book chronicling the last several years of his life and his thoughts on death, called How to Live Well and Finish Right. It includes a dedication to Judith Blomberg, his LifeCourse care guide.
Late Life is a production of Twin Cities Public Television in partnership with Allina Health, whose LifeCourse project, funded by the Robina Foundation, granted the producers unique access to their ongoing research into late life care in Minnesota.